Back home, health officials are teaming up with Red Cross for a campaign seeking to provide lifelines to more Filipinos. How important is donating blood to our kababayans, especially mothers, amid this health crisis? Joining us now are Dr. Christie Nalupta of the Philippine Red Cross and Dr. Prince Balaba of the Department of Health, Central Visayas. Doctors, thank you so much for joining us on The Final Word. Doc Prince, let's start off with you. Explain to us, what is postpartum hemorrhage?
Yes, Rico. Postpartum hemorrhage is an excessive bleeding following the birth of a baby. So recent data from the Department of Health shows that it is one of the leading causes of maternal deaths in the country. So accounting to roughly 16% as average last 2014.
So, Doc Christie, how often does this happen to Filipino mothers? And basically, what are the signs of postpartum hemorrhage?
So in the Red Cross, our blood distribution for patients with obstetric patients from mothers for child delivery is about 20%. So basically, that's for our postpartum hemorrhages patients.
What should mothers immediately do, Doc, when they experience these symptoms? Doc Christie. Doc?
Perhaps the Department of Health
Doc Prince,
can answer that.
What should mothers immediately do when they experience these symptoms, Doc Prince?
Yes, actually, if those mothers experience these symptoms, it is best to call their healthcare service provider or even consult at the nearest health service facility.
And do we have a national program for this, Doc Prince?
Yes, addressing and reducing those maternal deaths is one of our commitments under the United Nations Sustainable Development Goals through the Universal Healthcare Law. So actually, we have the National Safety Motherhood Program of the Department of Health, which focuses on the health and welfare of women throughout the pregnancy, especially the most vulnerable populations, Rico.
And of course, Doc Christie, with this postpartum hemorrhage, you need blood donors. Are we now seeing an increasing number of blood donors in the Philippines?
Yes, for this year, we're seeing an uptick of blood donations from our regular blood donors, but definitely during the height of COVID-19 surges, we really had a fall by 29% of blood donations from about 516 in 2019, 516,000 in 2019 to only 365,000 blood units in 2020, and it remained the same in 2021.
Remained the same in 2021. So is there some kind of hesitancy among our kababayans, Doc Christie, to donate blood?
Basically, because of the rising cases of COVID-19, probably they have the fear of getting infected in blood donation sites, or even be exposed with asymptomatic carriers, or perhaps the misconception of COVID-19 and blood donation, especially if they have had their COVID-19 infection, they are totally automatically deferred of donating blood, or even have gotten their vaccine, COVID-19 vaccine. But definitely after COVID-19 infection, 14 days after, they can now donate blood, or even if they had their vaccination, for as long as they don't have any side effects of the vaccine, then they can donate blood.
And Doc Prince, in your part of the Philippines, Central Visayas, how can we encourage more of our kababayans to donate blood?
Yes, actually, to our kababayans, donating blood is one of the best ways to help Filipino mothers who are suffering from postpartum hemorrhage. So actually, a 450 cc of blood can save as much as 3 lives. So by donating blood, we save more lives while also ensuring that good health and wellness for the donors. So it is very safe, and a best way to give and share to others, to voluntary donate blood. Jericho?
So, Doc Christie, what is also one of the advantages for us to donate blood?
Of course, it's really life-saving, and of course, you get to know you have your medical check during blood donations. We test the blood donations to 5 infections like hepatitis B, hepatitis C, malaria,
Right.
syphilis, and HIV. So those are some of the advantages once you donate blood.
And for those interested in participating in the Give Love, Get Blood project and they want to donate, what should they do, Doc Christie?
We have a Red Cross blood call center. They can dial 143, and we have call center agents. They can be directed to their nearest blood service facility. And another way of accessing our blood facilities is to go to the Facebook tool. Just go to the community resources, and there's a blood donation tool, and they can access their nearest blood service facility. Then they can donate blood.
Dr. Christie Nalupta of the Philippine Red Cross and Dr. Princely Balaba of the Department of Health Center of Visayas, thank you so much for joining us.